guys, Dr. Kendi here again, and welcome back to my oral health diaries. I hope you've caught up on our previous episode, because today we are going to just dive right in and start discussing about tooth discoloration. Before we proceed, make sure you've subscribed. Anyways, let's proceed now. So let's discuss about tooth discoloration. Many of us have probably experienced or have had someone complain about the color of their teeth. And for us, what we do, we classify the discoloration based on whether the source of the discoloration is extrinsic or intrinsic. So extrinsic just means that whatever has caused the tooth to change color is from an outside source and then has kind of like deposited onto the tooth, while intrinsic means that the tooth has developed with this issue. So the tooth has now become discolored as a result of an inside problem. All right, so up to there, I hope we are clear. So today's episode, I'm going to focus on extrinsic staining, or stains that have come about after the tooth has come into the mouth. And then now that's when you start seeing the stains coming about. So when we discuss about extrinsic staining, it's a very interesting topic, because most of us don't know like how the stains came about. We are just concerned that our tooth has changed color. So I'm going to repeat this phrase. It is always best that you seek the professional opinion of a dentist with regards to some challenges. Remember when we discussed gum disease and I kept insisting that the best thing to do is to get the correct diagnosis? Same to stains. Like, unless you know what is causing your stains, you'll just be managing them like haphazardly. The same way you take your car to like, it's called diagnostics. The same way you have to go into a dentist clinic or a dental clinic and have your teeth assessed so that we can know the issue to best help you. So let's talk about extrinsic discoloration. So when we talk about extrinsic discoloration, it can either be a direct thing or an indirect thing. Direct thing means I have eaten a yellow thing, then now my teeth have turned yellow. So that's direct. Most of the time it happens with things like tea or coffee, basically food stuff that have, we call them polyphenolic compounds. So these things kind of attach onto your teeth the way they are. So coffee, because it's dark brown, you'll start seeing some dark brown stains on your teeth. Then indirect discoloration is normally caused by materials that would basically react with other materials and produce a different color. A big culprit to this one is normally mouthwash, especially chlorhexidine-based mouthwashes. So you may find, yes, your mouthwash is green, pink, or all that, and then your dentist tells you it will discolor. So maybe in your head you're thinking, hey, Miss Jonas stains are pink, so I'll proceed. But that's not how it goes. That chlorhexidine will react with a bacteria on the tooth surface and will deposit a different color of stain on your teeth, okay? So that's how it happens, either direct or indirect. Also, another way you can choose to look at it is you have metallic and non-metallic. And when we go now to the metallic side, you can have things like dental restorations. A very common one is amalgam. Now, dental amalgam is one of our favorite materials as dentists. We love using amalgam. But there's been I'm saying universal, I don't even know if the other parts of the universe global. We were advised to kind of face down and then face out amalgam because of a number of challenges that came about as a result of the mercury that is contained in amalgam. It's a huge story, but either way, amalgam is still a very good material and it has been in use for a very long time. So because of the components of amalgam, you'll find that the tooth can get discolored, so it will become like grayish or black, depending on which type of amalgam was used. So you see, that's a metallic thing. Another thing we use in dentistry that could cause staining that we would classify as metallic is something we refer to as stannous fluoride. So when we discussed about prevention, I think when we were discussing about children, we discussed about topical fluoride therapy. Now, stannous fluoride is one of the most efficient topical fluorides to use. However, it comes with the disadvantage of having that staining effect. It'll become like brown, yeah? So most of the materials we use in dentistry that have this metallic part to them may bring about some sort of discoloration. And again, your dentist will always let you know what to anticipate in case there's something like that that's happening. Now, when we go to the non-metallic side, I think I alluded to it, but poor oral hygiene. Hey, guys, we have been singing about oral hygiene. So now, if you have poor oral hygiene, definitely your teeth are going to be discolored. Not only because of the plaque that's on the teeth, but there's also some things that we would like to refer to as chromogenic bacteria. So these are just bacteria that when they are digesting their food, they produce a colored substance in return. So these bacteria are going to make your teeth change color because they're there kind of breaking down the plaque. Remember, we said plaque is like the boat for the bacteria, and that's where they reside. So if you want to get rid of that, the best way is to make sure you don't have plaque. But chromogenic bacteria, definitely that's a cause. And if you have plaque and you take something staining like tea or coffee, chances are higher that you will get the stains deposited faster when you have more plaque. I've already discussed mouth rinses and food. And with food, it's not only, of course, tea and coffee. Unfortunately or fortunately, most of the foods that we eat that are colored could actually cause your teeth to discolor. But the benefit is if you're doing your oral hygiene routine well and you're going for your checkup to have professional cleaning done, then it shouldn't be something that should worry you. Again, extrinsic stains are easily managed. They are extrinsic. So it's just something that has come and attached onto the tooth. So most of the time, your dentist will advise for you to get cleaning done to remove extrinsic stains. We are going to show some examples of how these extrinsic stains look like. So when your dentist recommends something like scaling, it's not something that removes enamel, it's just to remove the stains. The stains are adherent onto the tooth, so we have to scale them out. Yeah, and then we use something a bit rough to kind of polish the tooth so that the same way I don't know what you call it in the motor industry, is it buffing or something like that? Like when you want your car to shine, you have to put something and kind of scrub it. So the enamel is not abraded in any way. There have been a lot of concerns about scaling and polishing, but the enamel is not hurt. So for extrinsic stains, management is quite easy. Go to your dentist, have cleaning done, that'll help you. There are also some toothpastes that your dentist may recommend so that they can make cleaning a bit easier for you if they notice that you're having a bit of a challenge with your cleaning. So the cleaner your teeth are, the less discolored they are going to be. Also, the restorative materials that your dentist uses, it's good that they let you know the possible outcomes of any of them or the treatment you're going to receive, whatever it can do in terms of color for your teeth. But good news is extrinsic stains are easily managed by your dentist, just on the chair, unaingia, unatoka, clean teeth, you're good to go. Thank you for joining me on this week's episode of my Oral Health Diaries. So we've finished discussing about extrinsic staining and we are going to the deeper part next week where we're going to be discussing about intrinsic stains and moving on into more complex stuff in aesthetic dentistry. If you have any questions, feel free to ask. Leave your comments in the comment section below. Also follow us on Instagram, on YouTube. Tell a friend to tell a friend. But thank you so much for choosing to learn more about oral health on my Oral Health Diaries. See you again next week.